4, 3.
Good evening. I'm Gary Christenson, Mayor of Malden. Today is Wednesday, April 1st, and I wish I could say that this was a joke, but we're here tonight to talk about something that is nothing having to do with April Fool's Day. And so before we begin, I want to introduce our panel. We have Chris Webb, our Health Director, and we also have John Oteri, our School Superintendent, who are going to provide updates in the city's efforts to try to beat back this deadly virus. But before I do, I just want to take a moment to say, how fortunate I am to be working alongside Mr. Webb, Mr. Oteri, and all of our city departments. As you can probably imagine, when this broke, there was no playbook to turn to in terms of how to operate the government. And so, but we all came together to figure out a way, and from police to fire to public works to public facilities, I really feel that we've been able to do as much as we can during this healthcare crisis. So I wanted to start off by publicly thanking all of them for doing their part to try to continue to assist our customers, again, during this very terrible time. A couple of updates. First, I also want to make sure I recognize Malden Access Television, our community partner, for helping us make tonight possible. But as of this afternoon, the City of Malden now has 75 confirmed cases of COVID-19. In addition, there are 85 individuals who are currently quarantined because they have been exposed directly or indirectly with someone who has the virus. Regarding the stay-at-home advisory, I think most of you know it was supposed to expire on April 6th, but the governor has since extended it to May 4th. The same goes for essential services. What is not included outside of essential services, or should I say essential services do include groceries and pharmacies. If you're unsure about what is an essential or non-essential service, please call us at 781-397-7000. And I also want to give a round of gratitude to Kevin Duffy, our Business Development Director, who has taken it upon himself to not just wait for calls from our businesses, but to actually call them on his own volition to see how they're doing and figure out whether or not there's any resources they need during this time. City Hall services. So our city buildings still remain closed to the public, but are open during normal business hours for phone calls and emails. Again, any questions, please call us at 781-397-7000. We also have on the web a city services status page, which has a complete listing of all our departments and how to contact them. And we try to update that on a regular basis. Another thing I think you're all aware of, that we recently closed all of our parks, which includes passive activity. We just took the step on Monday to add signage, yellow tape, and our police department is making regular patrols through all the parks to make sure that, again, we're doing all we can to stem the spread of this virus. Human Services, what can be said about Karen Cologne-Hayes? She didn't call us again. We didn't call her. She called us to say, what can I do to help? And she's worked alongside some great residents to put together this organization, Malden Neighbors Helping Neighbors. So if you wanted to contact them about what they can do to help our community, it's 339-224-4842. So again, this has been a really challenging time. But as I said during the last show, the one challenge that there doesn't need to be is the outpouring of support we've received from our city. From Yankee Pest Control to Pizza Pizza to Encore Boston Harbor to Malden Neighbors Helping Neighbors. It's truly been a team effort, and it's been great to see as mayor. Just earlier this afternoon, the Malden Girl Scouts brought some Girl Scout cookies to the Department of Public Works because, as you probably know, they had a series of water main breaks over the weekend that they worked. I think Mr. Knox said, the director, 24 hours at one point. So the Girl Scouts, again, came down to provide cookies to our workers. So that's been really heartening to see, and I want to say thank you on behalf of Mr. Webb, Mr. Oteri, and our city. So with that being said, let's get the latest and greatest from Mr. Webb as to what he's hearing, seeing, thinking, and then we'll go over to Mr. Oteri, and then I'll moderate the Q&A.
Excellent. You covered a lot of the really salient points, but it's really important to let people know that public safety is out there. The plan is in place. It does work. It is working. We had a lot of conversations today about hospitals and health care. I want to stress to people that we have the best health care in the world, bar none. This is not something that they practice every day, but they're prepared for it. The disease itself isn't what's the problem. It's supplies, and it's the infectious rate of the disease. That's the challenge. So I want everybody to focus on that, and if the only thing you can do to help that is stay at home and stay safe, wash your hands, sanitize surfaces, cough into your sleep, and don't go out unless you have to. And that really should only be to the supermarket and to the pharmacy. We're not seeing a lot of Maldonians doing anything other than that, and we're grateful, truly grateful, because we like to think our numbers are such that they probably should be higher, but people are doing a very good job. But we'll know over the next week and a half, 2 weeks, whether what we're doing is really going to get us through to the end. And I think it will. I think people, everybody I've spoken to, and it's many people, they wanted the best information and they want to do what's right. So when in doubt, just stay home, help out a neighbor if you can, always keeping social distance. And if you can't help them out, always call the health department. We have staff on, available 24 hours a day. The phone number to call would be 781-397-7049. That'll ring at my house every 24 hours a day. Okay. Crews on hand, and they're ready to do anything they can to help. Okay. I want to thank the police department and the fire department and EMS, because they took it upon themselves to get the best education they could in a very short period of time. They spent hours and hours, practically days, planning, so for a long haul, and it's been very impressive. Our police department is probably least affected in the area because they're following their training. Same with the fire department, and fire department goes to every call. Yeah. So I'm impressed. I really thought we'd be in a lot more trouble in that regard by this point. It didn't start out great because people were coming back from vacation, so there were some issues there. But it's really cleaned itself up well, and it's because the staff is following the guidelines. Okay, you can't go wrong.
Thank you, Superintendent Oteri.
Sure. So we made the decision on March 12th to cancel school indefinitely, but for at least 2 weeks, and that was really a decision that we made in consultation with your office and Board of Health Director Chris Webb, where we really couldn't give a date. At that point, schools, districts were saying we're going to close for 5 days, we're going to do deep cleaning. I think that we listened to a lot of the leading experts, including Chris, about we can't in good faith give a date of when it would be safe to return. We will return when it's safe. Right after that, the governor canceled school through April 6th. And then last week, he and the commissioner postponed that to May 4th. So our first response was to take care of our basic needs with our students. And what we did on Friday was we got our breakfast and lunch plan up and running so that on Monday, March 16th, we were prepared to serve breakfast and lunch. Those 2 days, we had to do them both separately because of the requirements that come with the USDA. But on Wednesday, we began serving breakfast and lunch together from 10 to 1, still there Monday through Friday at the Salemwood School and at Malden High School. We've made it so that it's a drive-through. We've got a tremendous staff. Omar Hernandez and our cafeteria workers have been real heroes in this. And people need to acknowledge them because they're out there in the cold, the rain, the wind, making sure that our kids and our families eat. The second thing is that we got learning resources up on our web. The commissioner over the weekend and early that week had said that this should be a time of enrichment and engagement. So our curriculum team, led by Dr. Kelly Chase, really tackled this full on. And by Wednesday, we had that up and running with broken down by grade. It's translated into 6 languages on our website. It was phenomenal. That's great. And then all of a sudden we got with last week, now you got to develop a remote learning plan, which we've got written. We're in negotiations with the MEA right now. We hope to have that rolled out by Friday so that next week we can get up and running with that. Also during this time, since we're going to be out more than the initial 3 weeks, and now that we want our families to access this, we begin a Chromebook distribution program that will begin tomorrow at the Ferryway School. We open that up Sunday night, families registered, and they select the pickup time. Again, we're trying to make this as contact-free as possible so that families can drive in and drive out. They're going to have their name on the windshield, on the right side of that windshield, and we have a team of volunteers. And again, we're in the middle of a pandemic, and we have people who are willing to go out there. We're going to supply them with masks and gloves, but they're putting their own selves at risk and to help our kids. We're distributing over 650 Chromebooks over the next 3 days. Remember, our high school students, we're a one-to-one district, so all of them have it. We have limited resources, but we want to make sure that there's at least one per family of a family that doesn't have technology at home. We're also working with our staff, keeping them engaged, and our staff is making sure that they're making the connections with our students.
Great. And before we start taking questions, we talked about the synergy between the departments, and two right here. I mean, great story I heard the other day was your nurses, the school nurses, wanting to help the health department during this time of need. Typically you might think, the nurses in the schools are in this silo, the health department on the city side's in that silo, but they step forward to assist Mr. Webb.
And we hope to be able to, formalize that later this week too with more. So
yeah, but just to call over and say, how can we help? Ms. Tremendozi, I think, right, the head nurse.
Yes, Director of Nursing. She's been over there all week.
Yeah.
But Chris and I
know
have
Debbie
talked sometimes.
has expressed interest, and it's
We've
just really great to see.
We've had a few of the nurses call over and really just want to know what the scope of work is. I think they'll all be comfortable with it.
And they all come at it from, these are our families and our kids, and they want to keep them safe.
Right. Very true.
So, and there's been days when I've talked to Chris as many as 10 or 12 times a day. Glenn Cronin from the police department, Chief Sullivan, that emergency management team has been terrific to work with.
Okay. All right, I'm going to borrow something from Nestor Dudley that he does on his show Around the Rim. It's called In the Webb. So I'm going to put you both in the web. I'm going to ask one question of you each, and then we're going to get to the most important thing, which is hearing from our residents. First to you, Mr. Webb. When do you think? I mean, we get asked this question all the time. Some have said the peak will be mid-April, then possibly we could get back to our normal way of life in May. What do you think, and what are you seeing?
I think that late May is probably a really
your
good
best
target
guesstimate.
Point. Yes.
Yeah. That school could be back. That
I don't know about school. That was something Mr. Oteri and I were talking about before we started the show. And the question on the table is, what is the reinfection rate? That will tell us everything we need to know. So we don't really know that yet.
Okay.
There's some guesstimates at it. But that won't come until after we start to level out, and that will start to inform that decision.
Okay.
But if I had to guess, and I do, I would say school is probably not going to happen this year. That would be my guess. There wouldn't be enough days to waste the time.
But you think some normalcy can return mid to late May?
I'd like to see that happen. Yeah,
Okay.
I think a lot of the non-essential workers, I think, will start to go back. We'll still probably see a lot of social distancing at different group levels.
Okay.
We'll go back to 25, maybe 50, things like that.
Okay. You're out of the web. Let me go to Superintendent Oteri. One question that we have been receiving from our students, will they be going to school throughout the entire summer?
Oh, that would have to be negotiated, and I think that would have to be, what powers the commissioner and the governor have during a state of emergency, I don't know.
But so far they've told you the 100?
Right now they've been very steadfast on no district would be required to go beyond what would be their 185th day. In Malden's case, that's June 19th.
Okay.
I think that forcing districts to go over the summer would be a real burden.
Okay.
A lot of districts have old schools without air conditioning. I think that there'd be some health hazards there. And
so you think we're sticking with that June date?
As of now, absolutely, yeah.
Okay.
I don't see that. I think that they've been really resolute on the 185th day, and for us it would be June 19th.
Okay. Another thing, I've been watching some of the teachers in the different schools have put together videos for their students. That's great.
It's
hats
terrific.
off to
They've
you
been
and
really heartwarming,
and
and just a way to connect with our families and our students. They miss them.
Yeah.
They, you know, we're social beings in education.
Right.
We rely on that social interaction to really, you know, give us energy, and that's missing. You know, even the collegial stuff. You know, the people that you teach next to, who you have lunch with, coffee. You know, those have all been taken away, and we're in a new normal of being isolated, and that's not what we are used to doing.
All right, let's take some questions. I do want to make sure that people know at home, the City Council and the School Committee have been in regular contact with us, and I wanted to publicly thank them as well. We have Ron Cochran, our Communications Director, along with the one and only Maria Luis, the Chief of Staff, here. So let's get to some questions. How do you want to proceed, Mr. Cochran?
Okay, so our first question is going to be from Facebook. Kind of two questions that have come in, and I'll kind of consolidate them into one, which is there's some concerns about how some of the local grocery stores are queuing folks in lines. A couple of things that have been mentioned would be one-way aisles, proper distancing, and, you know, inside the lines themselves. So just some suggestions. Is there a way that we could effectuate what they do there in the stores?
Yes, and I think our police chief, in conjunction with Mr. Webb here, did recently meet with Super Stoppage Shop, who I'm assuming that's who they're referring to, and I thought had made some progress on that front.
Yes, Super Stoppage Shop has put in barriers at the
As
registers.
of this week, right?
They started early, late last week, early this week finished. We also had them at the self-checkout go every other. We may expand that a little bit more. It seems to be working okay. They were putting tape marks on the floor to the head of the aisle, and then you pretty much look at the shelving and you go to the end of the shelving unit and wait. Okay. They didn't want to put too much tape down on the floor because there's a lot of elderly and the tape wears up and there's just slips and falls. Some of the other supermarkets have done the exact same thing. We've stopped all self-service of food throughout the city, so there's none of that. A lot of people have talked to me about the supermarkets, and the main concern is how many people are in there. What people have to understand is supermarkets are 30,000 plus square feet. They have air handling units in them to handle the heat from the refrigeration and all those things, so they can handle more people. So keep your distance whenever possible. Walking by someone isn't going to infect you. Just stopping and respirating and talking with somebody, that's when you're going to have a problem.
But you think they are making some progress?
They're making great progress. They're short-staffed, and they're still getting the sanitizing done. We have them checked every day. Okay. We go early in some days. We went late today, and I got no reports that were any issues.
All right, Mr. Cochran, why don't you grab some of the suggestions? We'll see if we can add to them tomorrow.
Sounds like a plan.
And what's the second part of the question?
It was essentially the same kind of question, which was whether or not there could be those types of changes could be implemented. But I think you guys have well covered it. I think we're going to switch over now. We do have Frank, who's joining us by phone in studio. So Frank, go ahead. You are on the air with the panel.
Good evening.
Hello. Can you hear me?
Yes, Frank. How are you, sir?
I'm good. I have a two-part question. The first part is I live in Suffolk Manor, which is senior housing, public senior housing, and once a month we were getting a food pantry over here, which is now discontinued, and also the YMCA was offering daily food pantries. Has the city of Malden come up with a substitute? I know the city of Everett yesterday offered its citizens a pick-up-and-go food pantry. And I was just wondering if Malden is going to come up with something like that. And
okay.
My second part of my question is dealing with the Internet. You can see that the COVID-19 has brought about where the Internet has become pretty important as far as education goes and connecting with people. Mm-hmm. And I personally would put the Internet on the same category as electricity or gas as a utility. That I am currently paying like $97, and I'm 78 years old, living in public housing, and I'm paying $98 a month for my Comcast. $17 is just for the television, and another $80 just to have internet in my apartment to stay connected with families and friends. To me, that's like another utility, and I kind of feel it's outrageous, and that COVID-19 is bringing up the issue of Wi-Fi and internet in the home. It's essential nowadays, and I think that needs to be looked into, and the price needs to come down.
Yep.
Those are the two issues I'm bringing up. Is the food pantry in Malden and the prices on internet.
Yeah, let's go in the reverse. On the internet, that's a challenge in good times. But what I'll do is I'll make a note and talk with Steve Finn, the Executive Director of the Malden Housing Authority, who has jurisdiction over Suffolk Manor and some of the other buildings throughout Malden, to see whether or not he's looking at trying to do something with access across those sites. I'll also consult with our Information Technology Director, Anthony Rodriguez, to see if he's heard anything, particularly during this crisis, to see whether or not there's a program out there that could be utilized for Suffolk Manor and beyond. So on the other question, let me turn to Mr. Webb to talk about the food pantry, YMCA, what's happening there.
Well, the YMCA is still active, but Karen Cologne Hayes' group is another great resource. It is a drive up as well. And if you go on the city website, you can go down to alerts and you can see that there's it says, or even better yet, go to MaldenNeighbors.org, go to the bottom of their screen, click, and you can register. They'll contact you, and you can set up your delivery times, what foods you like. It's a great program.
So, Frank, jot this down, MaldenNeighbors.org, or you can call 339-224-4842. And there's a bunch of volunteers that I'm sure that would be willing to help you during this time of need. All right, Frank? Thank you. All right, our next question.
Okay, so next we have a question from Facebook, and the question is for the superintendent. And the question is from Miriam. What happens when schools start versus if they don't start? If they start up again, will teachers have enough time to teach the kids to prepare them in advance for the following year? If school doesn't start again, will the kids be promoted to the next grade based on their level on past work?
Yeah.
Sure. So the state is obviously looking at this because all the schools in the state have been shut down. I would not envision a case where we would keep the kids back. In fact, that was a April Fool's joke that went around the internet today, that the governor was retaining all the students. But I would not envision that to happen. But what I would envision is if we were not going back to school this year, that the curriculum would be adjusted statewide so that there would be a catch-up time. We have gone through almost 70% of the school year, so you're really talking about a third, a little less, that would have to be made up, and we would probably incorporate it into sort of a hybrid year. I know that, in talking to some other superintendents and people who were in the field, a similar thing happened down in New Orleans with Katrina, where they kind of had the following year was a bit of a hybrid, and I would suspect that something along those lines would be rolled out. But right now we don't know, because right now we're hopefully coming back May 4th, but I defer to the experts in the field like Chris Webb. That might not happen, but I would not fear that people would be kept back, that they would be retained. Certainly the seniors, we would expect them to graduate, and everybody would be promoted, and we would adjust the following year for the curriculum.
Yeah, and the situation is fluid, as you could probably imagine. So our superintendent is staying on top of it and is aiming to provide another update Monday night, which we plan to have our regularly scheduled school committee meeting at 6 p.m. Details will follow, so I'd ask all of our families to keep an eye out, but we do intend to meet on Monday night, April 6th at 6 p.m., where he'll provide a further update as to what the latest is coming down from the state regarding the rest of the school year. All right, our next question.
So now we have on hold is Mary. So Mary, go ahead. You are on the air with the panel.
Hi, Mary.
Hi,
How you doing?
I'm okay.
Good to hear.
Okay. Am I on?
Yes.
Okay, hello?
Hello.
Okay, thank you. Thank you very much. I'm doing fine.
Good to hear.
I'm a senior and I'm living in my own home.
Okay.
And I've been in the home for over a month now. I'm very concerned, and I have a question. It's probably a public health question regarding the number of confirmed cases.
Yep.
In the past probably 2 or 3 weeks, my numbers, and they could be wrong, 9 confirmed cases, then it went to, 59 confirmed cases, and now we're at 75 confirmed cases. So I'm very worried, and my question is, what area of Malden? Okay, I'm up in the Maplewood here area. I'm very, very concerned, Mayor, Gary, Christopher, and I understand about the children in school. I have grandchildren and great-grandchildren, okay, and I'm concerned. I want to know what area of Malden are these cases centered at.
All right, let's turn to our health director, Mr. Webb.
That's an easy question and a good one. They're everywhere, Mary. There's
All right,
no
thank
one
you.
location. They're not bulking together. There's
But,
been... Sorry, Mary?
Oh, go ahead.
We only have one small cluster that we're looking at, and I wouldn't really classify it as a cluster yet. I think it's more of an incidental thing. So we did some looking at it. We talked to the facility manager there. We stepped up a few sanitary guidelines that they were doing, but we made them do them more often, and the building's leveled out. So we're confident that what we're looking at is widespread, and generally speaking, there's really no pattern to it at all.
Okay. So, Mary, these are spread throughout the city. There is not any one particular ward or neighborhood or area that these cases are emanating in.
And it could change over time.
Right.
When cases go up, the cluster, I wouldn't call them clusters. That's a bad word to use in epidemiology. But as they get more cases come, they're going to be geographically closer. Doesn't mean that there's a problem in that area. It just means that people in that area travel more, or they move around more, or they work under the certain guidelines that we have now. So the trick is stay home. Right. Really, it's not any more difficult than that.
Now, Mr. Webb, I think what also Mary was hinting at as well, are you seeing the average increase higher than other cities and towns, or?
No, I don't think so. From what I can see, I mean, our close neighbor Revere is really having a problem. I like to think it's because our emergency management group grasped this very early on. Yeah. We did training on this 2 weeks before the epidemic came in place. We had a tabletop exercise in Wakefield that it was well attended, right. And we got a lot from it. And I remember leaving there that day. Every one of us looked at each other and said, we all got something from this. Jeez, okay. We didn't think this way. Okay. And we really didn't think we'd have to, honestly. Okay.
And knock on wood, no fatalities?
None yet.
Today?
None yet.
All right, our next question.
Okay, so our next question comes from us on the YouTube side of things. So we're also monitoring questions over on YouTube Live. The first question is from Christina, and she asks if it's possible for facilities for the homeless to do self-cleaning, or potentially do something like put a porta potty over near where there might be a gathering spot, like for instance the Bread of Life, such as that.
Okay. Yep. Do you want to start, Mr. Webb?
Yeah. For the most part, there are resources here. We've had the warming center, which has closed, but we can check and maybe get some things up on the web. We had some arrangements with YMCA for certain periods where homeless men and women could go and actually bathe. Right. So we may be able to get that up and rolling again in conjunction with maybe meal service something like that. I just don't know how comfortable they are staff-wise to be able to open that up yet.
Yeah, and I know, Christina, the state is looking at trying to do something, and we are as well. We're participating in a conference call. We've been participating in conference calls this week, and we have another one set for Friday to see, what we might be able to do with some of the cities and towns around us and try to approach it regionally. But in the meantime, again, we are so lucky to have this resource, Malden Neighbors Helping Neighbors. So I'd recommend Christina call Karen Cologne Hayes in this organization at 339-224-4842 or visit maldenneighbors.org.
Okay, our next question is in regards to the seniors at Malden High School. Are there plans for things such as graduation, prom? Is there a plan for making those things up?
Well, right now, hopefully we come back May 4th. We'll see. We certainly will have some sort of a graduation. We'll work that out with the, school committee. That's a function, a state requirement, I think, that the diplomas are conferred. In terms of the prom, I know, I've talked with Principal Mastrangelo about if the regular prom doesn't go off, about trying to do something for our seniors, and I'm sure that the city and the school committee would be behind something like that as well, even if it's, much after when it normally would be held. But we would certainly like our seniors especially to have as much closure and, have those milestone events take place in some way, shape, or form.
Great.
Okay, so again, we're getting many calls from different places. We're monitoring the feed on YouTube Live. We have questions coming in on our Facebook Live channel, so we'll try to get to as many of these as we possibly can. But as always, when we don't get to one, we will chase it down in line and respond after the broadcast is done. Now we're going to go to Chris. Chris, you are on the air with the panel. Go ahead.
Hi, Chris.
Hello.
Hi, Chris.
How you doing, Mr. Mayor?
Good. Go right ahead.
I'd like to first start by saying thank you for all the hard work you and your team have been doing to keep the city safe during these times. And my question is, have you considered any sort of stoppage of construction in the city of Malden? I was out today and noticed that there is still work being done at what looks like part of the old city hall and more specifically part of the Ryan Family Amusements building. As a construction worker myself, many of my union brothers and sisters are out of work right now because of stoppages of work in Boston and Cambridge. And driving through the city today, I've noticed that it's specifically at the Ryan Family Amusements site, work is continuing. There was many workers less than 6 feet away from each other. And I would guess that most of those workers, if not all, are not Maldonians themselves. So they are traveling into the city, not abiding by social distancing guidelines, and then probably using our small businesses while they are here. So I was just wondering if you had considered any sort of stoppage of work to keep us safe here in the city of Malden.
Yes, and that's in effect immediately. The governor just amended his previous order to limit construction only relative to housing. So anything to do with housing will continue, as you could probably imagine why, based on the challenge we had prior to the virus and even more so now with our housing needs. But everything else will halt effective immediately.
Okay, so our next question is back to YouTube Live, and Christina asks, how can people join in the emergency response team?
There's actually two different teams you can join. There's the Citizens Emergency Response Team, which is a function of emergency management, and then there's the Medical Reserve Corps, which is a function of public health. You can go on the mrc.com and register for the Malden chapter. We right now have over 79 members. We haven't drawn on them yet, but we fully intend to. And for CERT, you can go to the City of Malden website, and go to the emergency management page, and there's a button on the left-hand side of the screen, I believe. Click on that, and the registration form comes up.
Yeah.
Glad to have you.
Mr. Cochran, so if you want to elaborate on that, but while you're doing that, we do want to acknowledge Glenn Cronin, the chairperson of the emergency management team, who Mr. Webb alluded to earlier, has really gone above and beyond
Absolutely.
during this crisis.
So perhaps the person is talking about our community emergency response team. I think, as was alluded to, we do have regular trainings that occur for that team. However, given the situation we're in, we would not be able to facilitate a training session. So I think at this point, the best intentions would be to go ahead and volunteer for the Malden Neighbors Helping Neighbors, which again, I think has been pointed out many times. I think that's the best way for this person to
Yeah, and what
go.
you could do, Mr. Cochran, is grab their information for when we do resume. They could potentially be one of our first calls to become part of our CERT team.
Yes, that's a great point. We will do that.
All right, do you want to go to our next question?
And reach back out. They are on YouTube, so we'll ask if they can please message or email us at info@cityofmalden.org.
Okay.
Okay, we do have one more caller. I'm sorry, I did not get.
Lost the audio.
Next question or caller?
Kevin?
Kevin?
Go ahead.
Good evening, everyone.
Hi, Kevin.
How are you, man?
Good. How are you doing?
Fine, thank you. Once again, I appreciate this forum. I believe information helps to relieve imagination. Our imagination sometimes can take us beyond the actual facts. So I do appreciate this forum. My concern is, I watched the president's daily update on COVID-19, and yesterday's was a little alarming to me, as they predict in the next 2 weeks, according to models, if everyone does exactly as they're asked as far as social distancing, that we may still have nationwide 250,000 deaths. Well, my issue is this, and I was hoping maybe the health director could respond to this. My issue is, we tell people to stay at home, but then there's things in the home that people may not realize they need to do to be safe at home. For instance, bringing takeout into your home, touching those bags, bringing groceries into your home that's been handled on the shelf. In our last meeting, y'all made a point that I use with my 5, 4, and 3-year-old, that assume everyone is contagious.
Right.
It's a very good learning point.
It's working with my children. So with that being said, is there a response to how you can make home, whilst you're hunkered down, more sanitary, more safe, more careful?
I think, Kevin, we're going to add you to Mr. Webb's medical response team. That's,
Yeah, we might.
You said it all. But
Thank you.
Why don't you add to it?
No, that's a great question. We're not saying enough about it, honestly. You want to do your social distancing at home, if at all possible. I'm lucky; it's just my wife and I. My daughters are out of the nest, but we find ourselves talking to each other from other rooms, which normally isn't my favorite thing. But it's really important to do. The other things are just about the takeout and bringing groceries in. You can wear gloves. If you're not comfortable going out in public with gloves, some people aren't. When you come home, unpackage the food, wash your hands. Before you serve the food, one person should be doing this, actually, too. They break down the food, put it on plates, and serve it. Don't use the takeout containers. As tempting as it is, don't do it. Then wash your hands and enjoy your meal. Then afterwards, police all that up, wash your hands, of course, again, and complete the meal. As far as sanitizing surfaces at home, a lot of people are asking about fabrics and things like that. There's really no science now that tells us how long. I'm going with 5 days because better safe than sorry. So on fabrics and things like that, a nice Lysol spray works very well, just as it does on hard surfaces. If you don't have any Lysol or you run out, bleaching water is a great solution. You can use 3 tablespoons of water per gallon of water, and that will clean and sanitize any hard surface you have. And it's very economical.
Yeah.
Also,
Thank you,
might
Kevin.
add,
You wanna answer?
on CNN, I think they had the CDC. There was like a 4-page how to keep your house corona-proof and as best it can. And I think it incorporates a lot of the tips there. But I know that was forwarded to me the other day, and it's pretty helpful.
Okay, great. Thank you, Kevin.
Okay, our next question comes, it's actually a variety of folks that have asked this same question, so we're going to kind of summarize it. Can you please comment on the use of any city buildings, either repurposing an existing building or trying to maybe rehab a shuttered building like Malden Hospital for use in the response?
Yep, Mr. Webb, we've talked about this.
We have. Okay. It's a good idea.
Yeah,
the idea is great.
Impractical, right?
But it's very impractical for a number of reasons. Mainly, you can't mobilize a hospital or these spaces that we're hearing about on the news without the help of the National Guard. It just can't be done, simply because of the logistics. And these are the Army Corps of Engineers are the experts when it comes to this kind of thing. We could try and we would fail miserably, even though we'd put our best effort forth, I'm sure. But as you can see in New York, they talked about it one day and it was done the next. That's the kind of response you want. But ultimately, those decisions come from the state, the governor, and the Massachusetts Department of Public Health, who are the licensing authority for all of the hospitals in this state.
Okay. And even if they said, let's do it, Malden Hospital is not the location, right?
No, Malden Hospital is condemned. That's not going to change. Right. We have shelter plans for our schools. We could enact any of those. We can turn any of those on tomorrow if the governor or a hospital felt that they needed that space for any type of patient.
Okay. All right, our next question.
Okay, so next we have Marie. Marie, you are on the air with the panel. Go ahead and ask your question.
Hi, Marie.
Hi.
Good evening.
Hi. I first think I want to commend the city of Malden for doing whatever they can do. But I have a question about the bike path. I live on Wade Street, which is right next to the bike path, and we were told that social distancing was supposed to be enforced there. I have witnessed so many groups of people in more than 10 walking together. So my question is what is the city going to plan for the bike path?
We're going to do everything we can. Just last week, our police chief, Kevin Molis, actually walked the path. Mm-hmm. But as you could probably imagine, we can't be there 24/7. You know, a lot of this is going to come down to common sense. And we're just going to have to keep doing what we can as a community to try to get people to understand the importance of what we're going through. Do you want to add to that, Mr. Webb?
No, I think that's really it. We get a lot of these questions, and
Right.
how do you keep people from? You know, I think their best intentions are to be socially distant, but they start talking and everybody starts moving closer together. It's the meet in the kitchen mentality.
Yeah.
So I don't think anybody's doing it on purpose. I think
Right.
it just ends up that way.
I mean, Marie, we'll ask our police department to see whether or not they can add that. Right now, their focus has been really on the parks, you know, with
Right.
the basketball courts, tennis courts, because those tend to really draw, you know, big groups. But we'll see if there might be a way, particularly as the weather gets a little bit better, that they could add the bike path to their patrol.
Well, I would appreciate that because witnessing it from my back porch, there are like 10 to 20 people, you know, in a group, and particularly among the teens. And I don't see a whole lot of social distancing. So my concern is just for the safety of Malden.
Okay.
Thank
Well,
you.
thank you very much, Marie. Be safe.
Thank you. You too, please.
So Marie brings out a great point. We do want to remind folks that as you see anything throughout the city that is not in compliance with any rules, either from the city or from the governor, we do ask you to call those into the non-emergency police line. So for instance, if you do see somebody at a park, call the non-emergency police line at 781-397-7171. And the reason being is if folks use non-traditional methods like Seeclickfix or putting it on our Facebook page, the response won't be there as quickly to get somebody physically down to usher these folks along. So it's really important that you just go right ahead, call the police. They are expecting and will respond to those requests. But thank you for all those reports that have come in. We also want to thank Jennifer. Jennifer sent us a message on Facebook, and she shared a wonderful video of a doctor who talked about sanitizing groceries as they come back. We're going to share that at the conclusion of this. So thank you very much, Jennifer. We will put that up. We are going to go to our next caller. I'm sorry, I don't have the caller's name, but go ahead, caller. You are on the air with the panel.
Good evening.
Good evening.
Who are we speaking with?
Carl.
Hey, Carl, how are you?
Very good, very good.
Go right ahead.
Mr. Mayor, I've got a short question, not a terribly serious one, not as serious as the earlier ones. Just a question on the blue bags. We're a household of all over 70s with 193, and we're running out of blue bags. Can we throw out a trash in a black bag for a couple of weeks?
We looked at that, and I think for now we're going to maintain the program that's in place. If you're in a position where you can't get out and get the bags, I want you to call 339-224-4842, and if you have internet access, maldenneighbors.org. Either way, call them and they'll try to assist you as best they can. But for now, where pharmacies and grocery stores remain open, we're going to continue with the program because they're also, we've had no problems with the deliveries in the stock. So, and I can assure you that JRM, our hauler, has not reduced the cost during this crisis. So we want to try to keep that for now, because one fear that we have is when this is over, and it will be over, the state and federal government, I think, is going to come down on cities and towns like ours to help make up some of these bills that they've passed. And so we just heard yesterday that the House and Senate at the state level are going to get back together and revise their revenue estimates for next fiscal year. So, one thought from our internal financial team, Ron Hogan, Chuck Rannigan, and others, that, this could be along the line of 2008 in terms of cuts. So, we're trying to think ahead a little bit, and keeping things status quo right now will afford us the opportunity to be able to better react to whatever may be coming our way going forward.
Okay, Mr. Mayor, thanks. So
right.
I'll call the neighbors group, see if I can get some thrown up on the porch.
Yeah, I'm sure they'll help you. I mean, everything that we've asked them to do, they've done it. And if that doesn't work, call us at 781-397-7000, and we'll make the assist.
Very good. Thank you very much.
All right, thank you.
Yeah.
Carl, thanks for the question. Our next question, we were asked for some clarification on what it means. This would be a question for Mr. Webb, the difference between confirmed and presumptive cases. In other words, are certain number of cases, are they tested and known as confirmed? How do those numbers break down, the ones that we share? And what does it mean to be confirmed versus presumptive?
Okay, you hit the nail on the head, Ron, but simply put, a confirmed case is tested and confirmed. So it's been reviewed by the State Department lab, and there are no errors. So that comes out to us as a confirmed. All other contacts or close contacts, travelers in the early days of this, or people close contacts would be put into isolation, and that's really the only difference. The confirmed is confirmed; they have been diagnosed.
Okay. Does that answer it, Mr. Cochran?
Yeah, we will respond in line. Hopefully that does answer the person's question. It was a question that was submitted to us online. Our next question is from Paul. Paul asks, in regards to renters, what should a renter do if other tenants in a building are ignoring social distancing or having parties in their building or anything that generally is, counter to what is being prescribed to keep safe inside of a building?
Well, I think there's two things you can do. Okay. Firstly, if there's a party or a large group, while it's happening, it's best to get a hold of the police. They're all trained on what to do and how to disperse safely. If that's not working and it repeats, call the health department, and we'll have inspectors out to deal with the management company and the individual tenant. The number to call for the health department is 781-397-7049.
But Mr.
Okay.
Cochran, just make sure that the person asking the question knows, do not sit on it. You know, this isn't a time when you say to yourself, I'll call that in tomorrow or the next day. We need people to act on it as it's happening.
Good point. We will refer that over to the person who asked the question. Our next question is from someone who's called into the studio. Scott, go ahead. You are on the phone with the panel.
Go ahead, Scott.
Hi, good evening.
Good evening.
Thank you for holding the forum.
Absolutely.
Just a question, and it may have already been answered. Sanitation practices in the grocery stores and pharmacies, is that being checked on a regular basis, like meat departments, seafood departments, things like that, to make sure that they're following good sanitation practices? Sanitation practices in the stores and the workers.
Okay, Mr. Webb.
Yes, they are every day. Actually, we have 4 inspectors, 3 of which are going out and doing the food. 1 is doing parks and other areas. The supermarkets are done every day. Like you said before, we've gotten rid of self-service food. Did a little bit of training up on pre-cutting meats, so there shouldn't be any issues there. Their Stop and Shop, for example, is pre-cutting weight and then putting it out for, you can take your own, depending on what weight or product you want. They probably will stick with that after a while. They seem to like it.
What about pharmacies?
Pharmacies, the same thing. They're doing, Walgreens is doing a bang-up job. CVS is doing incredible work. They are having problems with gloves and discarded materials in the aisles as well as the parking lots. And that's mainly the reason why we have the inspectors out every day checking all of that.
Okay.
So depending on the time of day or the crowd they've had and when we've been there, it's a kind of catch-as-catch-can kind of thing. But they know we're coming every day, so they're diligent, as diligent as can be with the staff available.
Okay, and if Scott has a question offline, call
781. 781-397-7049.
Thank you, Scott.
Thank you very much, guys.
Okay, our next question comes from Facebook, and it's, again, this is one of those ones that's very frequently asked, so we'll summarize for a lot of different circumstances. This person's concerned, Jennifer, saying that her husband's company was not closing, but she thought that it was not an essential business. What can be done when someone isn't sure if the business should be open or not? Who can they appeal to in that particular case?
I would say they reach out to our business development officer initially, Kevin Duffy, and he can be reached at kduffy, DUFFY, at cityofmalden.org, or you can call 781-397-7000, 7000. Not an uncommon question. We've had that happen over the past several weeks, which businesses can stay open, which ones can't. And I know the governor, I think, has been modifying that order. So any hesitation, I would start with Kevin Duffy, who's our business development officer and has his own section at cityofmalden.org under the alert if you wanted to peruse that ahead of time. But I think I'd start with Mr. Duffy.
Yeah, so we are constantly updating that page, as was indicated. Folks that want to go ahead and report those, again, kduffy at cityofmalden.org. We'll get that right over to Kevin. Again, I think most folks would, any kind of reporting, if you just check with us as it's happening. We have had folks reach out to us where they maybe send us a Facebook message and say that, like, hair salon is operating with the curtains closed, or nail salon's open with the door shuttered. A lot of times we get these reports 6, 7 o'clock at night after they've seen them, and there's absolutely no way that we can respond to them. So I think you've reiterated, Mr. Mayor, and I think we all said it, is please, right when you see it, say it. Okay, next we have Lisa. Lisa, go ahead. You are on the air with the panel.
Hi, Lisa.
Yes. Hi, Mayor Gary.
Good evening.
What is status of the drive-through? What is the status of the drive-through at Walgreens? I received an email from the corporate which stated you can get most supplies, as an over-the-counter non-prescription drugs, Tylenol, etc., at the drive-through.
All right.
However, when I went to the Walgreens here, they said it wasn't allowed per order of the mayor.
That's usually the case, is it not?
Oh, it's either you or me.
Yeah, right. Do you want to speak to it first, and I'll add to it?
I can't imagine why they'd say that. I would have to write it off to something like they tried and it didn't work, so they modified it. That would be my guess. They're really trying hard down there to help out any way they can.
Yeah, and I have to think, Lisa, I could check on this tomorrow if Mr. Cochran can get your
Well, I
information.
also called up, so.
Yeah, called Walgreens? Lisa?
Walgreens afterwards, because after I called corporate, they said, hello, are you there?
Yep. Are you there, Lisa?
Yep, I'm here.
Yep.
And then I called Walgreens back, yep.
Okay.
And I called Walgreens back after corporate said, well, they should have. And again, I was told the same thing by the manager. They're blaming the mayor.
All right, Lisa, there's some differing opinions here, so I want to talk to you afterward. Mr. Cochran, how can I get her information so I can call her tomorrow?
So, Lisa, we're going to suggest that you just send us an email to info@cityofmalden.org.
And Lisa, just say that you're following up on our conversation tonight. They'll route it to me, and then I'll personally look into it. I have to think there was probably something from when this crisis began to where we are now that they wanted to limit, what was being done at night because they weren't sure at the time of, how this virus was going to play out. But maybe they've since modified that. I'd have to look into it. But let me have a chance at it, and I'll call you back personally.
Okay.
All right.
Thank you very much.
All right, Lisa. Wait, can you make a note of
So we are at 8 o'clock right now, which is the normal end of our program. We're going to hunt down for a few more questions. The questions are slowing down, so we might wind down here. But I'm hearing a call coming in now. In the meantime, folks that want to go ahead and again ask their questions after the broadcast, please go ahead into that thread in Facebook and ask a question, or you can always email info@cityofmalden.org. And we're getting a lot of well wishes here, so I do want to acknowledge all those folks that are supporting us here on the Facebook thread. Thank you for the updates. Stay safe, keep us informed. God bless you. God bless us. It goes on and on and on. So I think people are really appreciative of this forum. So I did want to pass that along.
Yep, and we intend to have these forums. I think we're going to try to do them on a weekly basis going forward. So we might alternate the date, but thanks to, again, the great team here at Malden Access Television, they're willing to do as many shows as we want to help get the information out. One thing we've learned during this crisis, it's really about information and making sure that we're all, we're in this thing together.
Okay, so we do have a caller that's on with us, and Joan, go ahead. You are next with the panel.
Hi, Joan.
Hi.
Go right ahead.
Yes. Okay. My question is, what is the protocol for living in an apartment building, and how many times it needs to be cleaned? And also, there was one person as of last Thursday tested positive, and no information in our senior building since. How can we feel safe or find out anything else about that?
Okay. Go right ahead, Mr. Webb.
Okay, for the first part of your question, how often should they be sanitizing? That's going to be as often as humanly possible, right? So if you have an elevator in your building and it's in constant use all day, which I would imagine even now it's in steady use, we would like to see it done every hour. But it's not always practical because they're helping with repairs in other parts of the buildings and things like that. So if we can get a 3-hour rotation through the building, which is what we're looking for, on buildings 6 stories and below, obviously. Anything bigger than that, it takes much more time. But for the most part, that's what we're looking for. It max at 3 hours.
And you're on the phone with the owners of these buildings?
We actually had some good conversations today.
You're in touch with Mr. Finn?
We have been in touch with Mr. Finn today, as a matter of fact, and he's doing just all that he can with the staff that he has. He's asking people to, and I think this is really sound advice, is act like everything is not sanitized, and you'll fare better. But that's no excuse for not sanitizing.
Right.
And he understands that, as do all the property managers. It just comes down to what are all of the needs of the people in the building that day.
So someone tests positive.
Okay.
I think the caller was asking, so
Right.
what should they know?
And as far about, I know a lot of people have concerns about people testing positive in their building, but by law, we can't give out that information. In all things being equal, these people who are in quarantine are being spoken to every day. And we know where they are and what they're doing. They aren't leaving their apartments, and for that reason alone, they're harmless to anybody. So, and a lot of them, believe it or not, really, they call us some days. And they have questions, of course, but they also want to let us know they're doing better. We get a lot of good calls every day about people getting better quick, which is good news. And that means they were limited in their exposure. So keep that up, and if I could share it, I would, but I can't.
Okay.
All right.
Thank you very much.
Hang in there.
Okay, thanks. Bye-bye.
Okay, at this point, I think we've worked our way through many of the questions. We're going to go ahead and give the panel a chance to wrap up. If anything comes in while you guys are doing your wrap up that we can ask, we'll go ahead and pipe them through, but we do want to give that time.
I think another call is coming through, or
We do have other callers. Again, as we get them, we will pipe them back in.
Okay.
But go ahead.
So why don't we do this, Superintendent, Mr. Webb, we'll let you close, just say a couple words. And again, I would offer up information on how to reach you. If someone has a question about tonight's show or something comes up over the next couple of days, how do they reach the Malden Public Schools during this crisis?
Sure. So you can go to our website at www.maldenps.org, or you can email me directly at joteri, that's Joteri, at maldenps.org. You can follow us on Twitter at Malden Public. We push a lot of information out on that and make announcements. Also we'll be putting out a number of communications over this time. We try to get one out at least weekly to our families to give an update. We have a school committee meeting on Monday evening, so follow us. We're also trying to really take care of some basic needs with families. The last couple tweets that I've put out have been around families that need assistance from DTA, SNAP. So we've put out some information on how to register for that. Any family who is qualifying for a free reduced lunch now automatically qualifies for SNAP, and we have a number of families who have not made that transition. But right now, because circumstances have changed rapidly, we're pushing that out. So we want to make sure families take advantage of that. We also want to make sure our families are getting the free breakfast and lunch, 10 to 2 every day, Monday through Friday, at Malden High School and the Salmwood School. And we look forward to providing you with as much information up to the moment as we can. We want to wish all of our families to stay safe. We don't use the term social distancing because we want to make sure that we maintain that social connection, so we call it physical distancing, because we really want to make sure that there is that social emotional connection which is critical to supporting our students and our families.
Okay, great. Thank you.
Well, after hearing everybody's comments tonight, I really think that it's important that people know they can still call the health department. We're active all day long, 24 hours a day while this is going on, and our staff standby is willing and ready to help. So please call 781-397-7049. If you're not sure where else to call, please call us. We'll help you get where you want to go. Typically it ends with us anyway if it's related to the virus. We're going to be looking at the bike path as well. Maybe we can get some signage for that and just put it along intermittently, like maybe some side lawn signs or something like that. Just reminders for people, exercise but spread out, things like that. I mean, we got a lot of good feedback tonight. We're hopeful. My concerns are still the same, that everybody stay at home, do the best you can with physical distancing, do best with your hygiene as humanly possible. I stress this a lot and people look at me funny, but really watch the bathroom space, right? Because we get comfortable in there and everybody has a little nook, and it's a good idea if you have the time, break that down, sanitize it, every other day or so, and that really will slow the transmission, move the toothbrushes away from each other, things like that. So we're finding that that's our concern for the younger crowd, children and infants. There's been one infant in the state so far who was quite ill. So they think that might have been just that mother-son time. But it equates to brushing your teeth, same thing. So we really want people to think their day through, right? Don't make more plans than you're physically capable of under the rules that we have. And, watch out for your neighbors. That's a huge thing. It's just like a snowstorm. A lot of folks might be too proud, and that shouldn't get in the way of staying healthy and being happy and enjoying the community. So if there's anything you think you need, or you think anybody, you don't know who to turn to, call the health department. We'll be glad to help you out. Okay. Absolutely.
Great. And I just want to end by really how I began, which is thanking all of you for your interest and commitment to our city. Just today I was on the phone with our United States Senator and Malden's own Ed Markey. We have regular calls with our state delegation, city council we've been in touch with on a regular basis. And again, just can't say enough about our City Hall employees. We didn't know where this was going to go back when we had, the big meeting on how we were going to have to conduct business going forward. But from all accounts, they've met all of our expectations, and I just wanted to say thank you to everybody that makes up Malden city government. And then again, the residents themselves. This would have been one we would have understood that, you just went into a silo and waited until it was over, but you've done anything but that. Malden neighbors helping neighbors, again, Pizza Pizza, Yankee Pest Control, Creative Audio, Paul Murphy Insurance, Encore Boston Harbor, and the beat goes on. Malden Girl Scouts today, we just can't say thank you enough for really rallying around our community. And without further ado, we just want to let you know that we will be back. We'll continue to provide as much information as we can. And, thank you to Malden Access Television, Maria Luis, Ron Cochran. And again, if you want to know that there is hope, on the way up today to this show, I couldn't help but notice a big, bright sun at the end of Pleasant Street, just as we were walking into the studio. So it will get better. Hang in there.
Yep.
Thank you.
Thank you.
Thank you. You're welcome.